My name is Makenzie Abbott. I am a newly graduated physician assistant. I graduated in December and I got certified and licensed in February.
Okay. You are currently in New York City helping fight the coronavirus, and you're seeing like the stuff firsthand. What made you decide to go to New York to help?
Yeah, so I was in the process of looking for permanent employment when the coronavirus pandemic hit. And so obviously, no one is hiring back home. So I didn't necessarily have a job that I was like leaving to come here, but I just really felt like it was a good opportunity for me to gain experience and to really just put the skills that I had just learned through school to the test and be able to do something meaningful
Yeah.
in this and where very many people can't really.
Mm-hmm. Yeah. Oh, how did you hear about this opportunity?
Yeah, so I belong to a Facebook group for physician assistants kind of nationwide. And somebody posted something about this. They said, hey, this company sends people to like disaster areas. Usually it's after hurricanes or something.
Mm-hmm.
They're looking for people to go to New York City. And so my husband and I were in the car and we were talking about it. And I was like, I'm going to do it. If it's a scam, it's a scam. So I just kind of emailed the people and I actually got a phone call like that next probably like a week later. And they asked me to go. Like I was actually on my way home and they were like, can you leave tonight? And I was like, no, not really. And so then they were like, okay, well, follow us on Facebook. So I learned a lot more about the company on Facebook. And I called on a Monday for physician assistants to apply to New York. So I called on a Monday and I left on that Wednesday and started work Thursday.
Wow. So like you've been at it like for like at least like a solid week and a half now, is that correct?
Yeah, so I've been here 12 days.
Okay. And then you're there for 21 in total, correct?
At least 21.
Okay.
I'm
Okay.
actually planning on staying another 2 weeks, I
Okay.
think.
Okay. So since you like kind of have your schedule kind of figured out, like what's your typical day like?
Yeah, so we get on the bus at 5:30, 5:45 in the morning. Physician assistants and nurses that work at 7 o'clock. That's our bus. Usually we leave our hotel at about 6:15, and it's about a 30-minute bus ride to the hospital that I'm working at. And so then I work from 7 a.m. to 7 p.m. And then I work till about 6:30 so I can catch my bus. And then we bus back. It takes about a half hour to get back. And then as soon as we get back, you have to shower, take all of your stuff off, put it in a laundry bag, shower, and then you get to eat dinner, and then you go to bed like an hour later.
Oh dang. Can you kind of describe like what your workplace environment is like? Like I know it's probably a little bit chaotic, but in your like, yeah, how do you see it?
Yeah, so it's definitely chaotic. I'm working on an ICU unit.
Okay.
So it's not ICU in the typical sense that people think of ICUs at like regular hospitals, because the entire hospital is an ICU. So I'm actually like on a med surge floor that's been turned into an ICU. So I work with all ventilator patients. So all of my patients are on ventilators. There's one doctor usually for every like 4 to 5 patients, or one provider for 4 to 5 patients. Nurses, they're being pushed to their max, obviously, because there's more people. So nurses are taking on a lot more patients than they're used to back home or than they're used to on their regular schedule. It's just very chaotic. People are trying to make sure you have the right protective equipment, and that runs out really fast throughout the day. So it's hard to try to get that from like the central supply where it's all kind of locked up. So, I mean, it's definitely very chaotic. Everyone's just trying to do their best to provide for their patients with kind of the resources that we have right now.
Yeah. Yeah. What was kind of your expectation going into this job versus like what it actually is like?
So I had no idea what to expect.
Mm-hmm.
I kind of expected, I was very nervous coming in as a newly graduated PA because usually when you're a new grad PA, they kind of almost hold your hand a little bit to kind of introduce you to the job and everything. And I was not expecting that to happen here at all. I was expecting to be thrown in and you have patients, you have to treat them by yourself. And I was expecting there to be patients in the hallways. I mean, because you hear the stuff on the news, you hear that the hospitals are completely overloaded. So I kind of expected, I guess, people to just be everywhere, sick people to be all over the place. And it hasn't been like not patients in the hallways. Obviously, every patient has a room, and my healthcare team that I'm working with, there's an attending provider, obviously, that oversees us, and there's also medical interns, and so we kind of just jumped into their rotation. So we have patients, but we have a third-year medical student that supervises us, and also a physician. So it's much more of a team effort, which is really helpful because a lot of them, they're used to treating patients like this. So
yeah,
hasn't been as bad as I had expected.
Mm-hmm. How many people are actually, like, do you know the number of, like, how many people are on your team or that you're working with in the hospital?
So all of their floors have at least 2 units on them. My unit has 32 patients on any given day. We have 32 patients, and I'm trying to think. I know we have a team of probably 10 doctors in just my unit. That's medical students, attendings, kind of all of that. And then during the week, they have about 14 or 15 nurses. And so the nurses are anywhere from like med-surg nurses that do like the medication daily care. And then they also have ICU nurses on every floor that manage the ventilators and things like that.
Okay. Yeah. Kind of switching gears a little bit. How are you staying in touch with your family and friends back home?
So my room at my hotel doesn't have great phone reception. So FaceTime has been kind of hit or miss. I call my parents and my husband every night on Google Duo, actually, which I had never used this. And my mom has recently gotten into Zoom meetings, which I guess is a thing now.
Yep.
So yeah, I see them. I talk to them at least every day, and then I usually FaceTime them at least every day also.
Yeah. What do you think is something that you'll be able to apply from this experience to like your future career opportunities?
So I think everyone that is working here in New York gains a little bit of humility for sure. No matter what their, role in this is, doctors, nurses, everyone, because, you do see death. It happens every day. It happens multiple times a day. I think that is valuable. I think just the exposure, how to handle it when a patient dies, I think is a valuable thing for a provider to take away from an experience like this. And I think, me personally, I'm gaining a lot of medical skills that I didn't learn necessarily in school, but that I will be able to apply to future jobs. And I'm learning knowledge about coronavirus that hopefully I'll be able to take back home and kind of share my knowledge when I get back.
Thank you again for taking your time out of your really busy day, because obviously you are jam-packed. And second off, thank you for like helping people in need, because obviously New York is a hot spot and you're putting yourself on the front line. So we really appreciate that. And yeah, that's all I have for you.
Well, thank you.